Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OB/GYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today, we are talking with Dr. Lina. Welcome, Dr. Lina. How are you doing today?
Good, thank you. How are you doing?
I'm doing well. I am super jazzed to have you here because I want you to introduce exactly what it is you do, because I am fascinated with your job.
So I'm a chiropractor. I specialize in prenatal and pediatric care.
Prenatal and pediatric care as a chiropractor. Mm-hmm. Okay, so explain to our listeners and our viewers how you got to where you are in training. Like, how does one get to be at that level?
So essentially, after graduating with your doctorate of chiropractic medicine, you can choose to take additional courses and seminars with the ICPA, which is the International Chiropractic Pediatric Association.
Okay.
And they can certify you through there, depending on how many courses you take, et cetera. But there is the Webster's course, which is specifically for being able to treat pregnant moms. And then they have a bunch of other classes for, pediatric and babies and stuff like that.
So you said Doctor of Chiropractic. Do I say that right? I always mess this up. She and I've said this before, and I'm like, I think I said it wrong again. Say it properly for me.
The proper title is Doctor of Chiropractic Medicine.
Doctor of Chiropractic Medicine. Mm-hmm. How long is the school to get your Doctor of Chiropractic Medicine?
So it's 3.5 years of nonstop. So no, like all year round.
Okay. 3.5 years. And Correct. Did you do that here in Canada? Are you Canadian? Is that right?
Canadian.
Okay.
Yes. I did my undergraduate studies in Canada, but I did my doctorate in LA.
In LA. Okay. And so then once you finish those 3.5 years to do what you're talking about the extra training, how much extra time did that take of kind of schooling or studies and stuff like that?
It just depends on how many of the seminars you want to take, but a seminar is over the course of a weekend.
Okay. So perfect. So I want people to know, I did not know this existed. Like, I know that chiropractors exist, but I did not know that there were chiropractors that then kind of subspecialized further for pregnant individuals and then also for neonates and kids and just in general, but also kind of like neonate, like the babies, right? Okay, so I'm just like, my mind is still blown, and I've known Dr. Lina for a while now, and I'm so happy that I was introduced to her because I was like, this is awesome.
It is awesome.
So like, for people listening and watching, as a provider of pregnant individuals, when they have issues with things that I know that they've seen a chiropractor before, I always had troubles finding a chiropractor who would treat someone when they're pregnant. So can you kind of walk me through, if someone is pregnant and they're like, man, I do want to see a chiropractor, how could they do that? Because sometimes the provider might not be their OB provider might not be the best one to get them to someone like you.
So if you go on the ICPA website, which is ICPA for the number 4 kids, mm-hmm. they have a list of all the Webster certified providers in each area, obviously around the US. So they can find somebody who specifically has the Webster certification and can treat, which is only for pregnant moms.
Okay. And the Webster certification, is it for pregnant individuals throughout the gestation or just for the time around labor?
Throughout.
Okay. And I think that it confused me, I think, because when I hear Webster's, I think of like, it's for labor. I don't know why I think that. But tell us a little bit about kind of like the things that you can help someone with in a pregnancy that are right in your like wheelhouse.
So basically, Webster's is a specific analysis and adjustment of the sacrum, and the purpose of it is to remove stress off the nervous system, balance out the pelvic bones, muscles, and ligaments so that you're optimizing the mom's pelvis for labor and delivery. So having said that, when you are adjusting and you're taking that pressure off the nerves, it can relieve a lot of low back aches and pains, a lot of discomfort that a pregnant mom will go through. And it also balances out the pelvis so that she has an easier time going through that labor and delivery.
I love that. And I also, that you're going to laugh, and there's a, what do you call those things in a chiropractor's office where you can see the whole spine? Is that just like
the dry spine is what they call
I have a dry spine.
You have a dry spine. That's so cool.
Please hold, everyone. Okay. So we're back, and I found this, like, legitimately. I found this where we are. And maybe we'll include this or not, but shout out to Gage Mathers Law Firm for allowing us to utilize this wonderful space. And I found this in the outside part, like legitimately just found this. I saw it earlier and I was like, I wonder if Dr. Lina could use that. Okay, so.
I actually thought about bringing mine
Did you?
That's
okay.
So
I feel like this one's twisted, right?
A little bit.
Okay, so this is scoliosis. No. So when I'm asking Dr. Lina what she does and what she can do with pregnant individuals, and she mentioned the word sacrum. So I just thought, of course, we can take and put a picture of a sacrum later and make it look, electronic and computer generated or whatever. But since it's right here, can you show us some of the words that you may mention that you can, what you're working on with a pregnant individual and stuff?
So I'm going to just bring this down a little bit.
Yeah.
Okay, so essentially this piece right here, this is the sacral bone, this one right here. This is such an important bone because it's the only bone that's connecting your pelvis to your spine, and it can misalign. And of course, with pregnancy, a mom's body is going through so much stress and different stressors. So there's the weight gain, there's the body releasing the hormones that lets all of the ligaments relax. So it's stretching out all the joints. There's the shift of the center of gravity. So there's all these different things that play in. Everything is kind of changing. And it's very easy for this bone to move out of alignment. So
the sacrum.
That one right in the middle.
Yeah.
That's the sacrum.
And so for people that are just listening, obviously you're not going to be able to see any of this, but that's what you get for listening and not watching. So,
so with having said that, the reason why I'm biased, but I think that this is such a vital thing to be able to do for moms throughout their pregnancy, leading up to labor and delivery, is that the three biggest reasons for dystocia, which is difficulty during labor, the first one is power. So the uterus's inability to properly contract, or the cervix to contract with enough power.
The squeeze of everything. And so and all the reasons that I'm going to list that cause the three main reasons that cause dystocia, having a sacral misalignment can contribute to that. So correcting the sacrum and getting it in a more aligned position, in other words, can help a mom not go through, all those difficulties during labor. So when the sacrum moves in a position that's not ideal, when it's not in its correct alignment, naturally you're going to build a lot of inflammation in that joint space, just like you would when you sprain your ankle. When you build a lot of inflammation from this joint specifically, you have all these nerves coming out, the sacral nerves, and that puts a lot of pressure on those nerves, all the inflammation that starts building up in the joint space. Those nerves are going to go control or supply the uterus, the whole reproductive system, but really the uterus. Yeah.
And so when it comes time for labor and your brain is trying to send messages through those nerves to the uterus, telling it to start contracting, you don't want to have any interference. You don't want any pressure on those nerves. You want the messages to be able to go through the way they're intended to.
Yeah.
So that's one of the big reasons of why we want to get that pressure off of those nerves, so that your brain has proper communication with your reproductive organs when you're going through labor.
So when you mention that, I want to tell the listeners and those watching too, the sacrum, if you do there's different types of dystocia during labor, or like ways that the labor doesn't go as we'd like it to. But I want people to kind of know when individuals are pushing during labor, we have you do almost like this knee to chest thing. And we're trying to take the curvature of the parts of your spine and make them more conducive to allowing the fetal head to dip underneath your pubic bone and kind of like with lack of a better term, straighten out your birth canal. I mean, it's not truly straightening it, but making it to where there's more of a straight shot for the baby to come out and not have to go around so many curves. And part of that curvature on the front side is the pubic bone. The back side is the sacral bone. Mm-hmm. And so when she's talking about the sacrum, I can tell you that the sacrum, although we can't see it when a baby's delivering because it's inside the patient's body, we know that we want it to be in a certain position to try to help the baby come out.
So that's actually my next.
Oh, is it? Oh,
so the first reason was power. The second one is passage.
Ah, yes.
So anytime you have a pelvic misalignment, whether the sacrum is rotated, whether it's these guys that are doing this or this, so moving back or forth, you're automatically creating.
So when you say these guys, for the people that can't see the iliac
bones.
crests,
yeah.
hip bones.
The hip bones. So because of the fact that they're going all the way down, they're impacting the pathway that the baby is going to be coming out from.
Sure.
So the more aligned the whole pelvis is, the bigger the pathway is for the baby to come out, or the more straightforward it is, right? Versus if there is a misalignment, now you've restricted it a little bit more.
Sure.
So that's the second big way that it kind of helps pregnant moms have a smoother labor and delivery. And then the last one, of course, is the passenger, which is the baby. So if you have a very constricted space in the uterus, if there's a lot of tension there, the baby might not be able to move around to get in the proper position. So if the baby is sitting in an awkward position, if they're breech, they're going to have a harder time coming out. So when we release all the soft tissues that are supporting the pelvis, so the round ligaments, the hip flexors, the sacrotuberous ligaments, we are giving space in the uterus for the baby to get in the most ideal position that they want to get into, which is usually head down.
Yeah. We like head down.
And
I love looking at this. So those listening, we're looking at, what do you call it again? A dry spine?
Dry spine.
A dry spine. So it's literally like the axial spine. Is that right? Did I say that right?
Yeah.
I mean, okay.
Yeah.
I haven't done been in an anatomy and physiology course or anatomy course in a long time. So we're looking at from the base of the skull all the way down to your sit bones or your tailbone.
Correct.
Right? So I can see all the vertebrae and stuff like that. The thing is, for just in general, the hole looks so small to allow a baby to pass through it, by the way. And so tell me a little bit about, too, like the pubic symphysis. So people can have pubic symphysis separation during pregnancy. And I can tell you, having had patients with that, there's not much I can do for them. They can wear I've I've prescribed some like tightening items they can wear around their hips, a belt. Yeah. But there's no way to fix it when they're pregnant, unfortunately. So I would love to talk about that. And just the fact that obviously that area is meant to have some laxity to it, but when it separates, it can be very painful. So can you kind of talk a little bit from your world about the laxity that's there, and if there is a separation for things you can do for people during their pregnancy or after their pregnancy?
So the biggest thing with PSD is
pubic symphysis
dysfunction.
Okay, thank you.
Yeah, it's going to be trying to manage it throughout the pregnancy.
Yeah.
So in addition to doing all the proper, like the regular Webster's protocol, then we would add something that they can do at home would be squeezing like a block or
like a ball, like a squishy ball or something.
Yeah, and then trying to keep the knees together as much as possible. So not like when getting out of bed, when getting out of the car, not opening the legs. So trying
keeping them together.
The knees together, yeah. And not,
adduct more than like bring them together.
Yeah.
See, and I want anyone watching and listening to know, if you see your OB provider, I can almost 9 times out of 10 guarantee you they have no idea the correct exercises or things to do when you're in this situation. They would likely recommend you see a physical therapist or a chiropractor or someone that knows this, because that's not in my wheelhouse.
Yeah.
And I've done the OB, GYN and maternal-fetal medicine training, and no one ever taught me that. It was never brought up. It was never mentioned. So
yeah, fair enough.
If it's bothering you, seek out care with someone if your OB provider might not be the one that knows it or is not getting you to the right person. Then that brings me to we already talked about if you wanted to see someone, where to find that online, which is good. Then that brings me to, you mentioned round ligament pain. Mm-hmm. And I've talked to people about this in the past. And the round ligament is fascinating to me because I tell people if you didn't have it, your uterus would be a bobblehead because you need something to like anchor it down, right? Yeah. The way in which I don't have the bobblehead here. And I've said this on Amber's podcast. I visited with Amber a while back and I told her that I have a bobblehead of Mark Johnson in my office. And he was the Texas A&M baseball coach a long time ago. He was a great coach. And that's the only bobblehead I have. I don't know why I have it. I have a bobblehead of Mark Johnson. And so I can show it to patients sometimes and say, this would be your uterus if you didn't have these two ligaments. Mm-hmm. And the weird thing about the round ligaments to me is that they get bigger during pregnancy, first off, because it's almost like they need to be stronger. Yeah. It's fantastic. They're like more the size of my thumb plus, and they're usually like less than the size of my pinky. That's I would say an easy way to say that. So they're getting bigger and stronger. And they start up at the top of the uterus. They insert in the back portion of the inside of your body. And it's just this weird space. So I'm going to kind of point to this thing here. When it goes into the body, you're going like way back by where the sacrum is. I mean, you're going posterior inside the body. So when people come to you and you think they have round ligament pain, what are the symptoms that you see? And then on top of that, how do you help them?
So the most common symptom is like they feel like a contraction or like it's like squeezing or
tugging. Do they ever say tugging? I feel like people say like
yeah. It's like a spasm or a tug, and they really feel it if they like cough or sneeze. It like kind of spasms on them.
Quick movements, right?
Yeah. And a ligament, I mean, it's different than the muscle because it does, when it tightens up, especially if it tightens up more on one side compared to the other, it does like torsion, like it like does this almost when it tightens up.
She's doing like a yes, like if you took your fist and went like yes, right? Like yes. It twists. It rotates and twists.
Yeah, and it gets tighter.
That is wicked.
Yeah.
That's mean.
So if it happens unilaterally, that's where you really do want to get it released because it's tugging on one side of your uterus, causing more tension in your uterus. Sure. That's what we're trying to avoid.
Yeah.
So the way that it's just releasing it like you would, it's very similar to releasing like a knot in a muscle.
Okay.
Right. So you're just kind of holding and breathing through it to allow the ligament to start
untwisting or the aggression that it has there. Okay.
Yeah.
And then I'm assuming that someone with round ligament pain wouldn't have to come in all the time, that you could kind of teach them some stretches or something to do at home that kind of helps get them moving so that when they have that cough, laugh, or sneeze, it's not as uncomfortable.
Yeah. And it really depends on like which phase they are in the pregnancy. So somebody who is, let's say, a month out from their due date, we would recommend that they come in about twice a week because the stress is increasing. You're going through like all these different growth spurts. Your body is really getting ready for the labor. And so you want to stay ahead of the game versus, having it build up. So if they're at the beginning, they can totally take more time between visits and come in as needed. Towards the end, we recommend higher.
More frequently, yeah. Mm-hmm. And I think that some people too get nervous about, if I see a chiropractor during my pregnancy, it could be dangerous to me. So I'm gonna move this thing for a second because I want to be able to like look you in the eyes when you tell me about this. Please hold. We're gonna see if this moves well. So let's address the question that people might have on if I'm pregnant and I would like to or need to see a chiropractor. Some people have this concern that seeing a chiropractor during pregnancy is dangerous. So can you kind of address why it's not dangerous if you're in the right hands, I think, right?
So you want somebody who is used to seeing pregnant moms, who's Webster certified. They're not going to be like rotating you and doing too much twisting, and you're not getting like the regular manipulation that another regular adult who's not pregnant would be getting.
Right.
So it's not the same type of an adjustment. And all research that has been done on Webster's and pregnant moms shows that it's very gentle, safe, and effective. So,
right. And I think that people get nervous about someone is going to try to, manipulate my uterus and that's not done, right? Like you're working on mom's hips or things that are attached to mom, right? You're not moving or manipulating the uterus.
No. And that it is illegal because it's outside of our scope. So it has to be when you're doing chiropractic care, you're correcting the pelvic bones, muscles, and ligaments. You're restoring balance to those to affect the health of the nervous system, but you're not really doing anything in relation to the actual uterus, the baby, or anything.
There you go. And I think you and I have kind of talked about this some too. It's like the stuff that we all see on the internet for chiropractic work is sometimes always like who can get the most of a pop or the loudest whatever. That's not what you're doing. No. Thank you. Thank you.
It's very gentle.
I think that that's what the layperson has in their mind of chiropractic work is like the pops, the turns. It's going to be painful. It's got to be painful. Otherwise, it's not working. And that is not true.
No.
Okay. Perfect.
No.
Is there a certain school of chiropractic work that's different than others? Like one is a gentle and one is a more aggressive, or is it all chiropractic work?
The chiropractic world is very complicated.
Okay. That makes me feel better because I feel like I don't know much about it. So
I'll say this. There's over 200 different techniques within the profession. So you could have a chiropractor that doesn't even touch their patient because it's all like energetic work. You could have a chiropractor who's doing adjustments with a tool. You could have chiropractors who are doing manual manipulations. It's all sorts of different things that are considered chiropractic.
What would you describe? I don't know if it's just one or if it's multiple. What would you describe what you do for a pregnant individual? I know Webster's is part of it, but is there a way you would describe it?
It's manual. So I use my hands. It includes the sacral adjustment. It includes releasing certain muscles like the piriformis muscle. It includes releasing some ligaments, like the sacrotuberous ligament is really important on, it's kind of in the glute area. And
that's near your butt.
Near the butt, yeah.
That one I know.
The round ligament, the hip flexors. So it's all using the hands.
So whenever you see your provider and there's concern for round ligament pain, which by the way is usually exactly what Dr. Lina was saying, you cough, laugh, sneeze, and you get a quick discomfort. However, it does usually go away rather quickly. It shouldn't stay. So if you have pain after coughing, laughing, or sneezing that doesn't go away, that's probably not round ligament pain. So it comes and goes rather quickly, and it can be sharp in nature. So that's usually how it feels. And if your provider says there's nothing I can do for you, that might be true that they can't do anything for you, but it's not that there isn't anything that can be done to try to learn to understand the discomfort, because round ligament pain doesn't always go away. That's the thing. Yeah. But you can learn how to kind of adjust your body a bit to make it not as painful. Is that a good way to say it in your opinion?
Yeah. So it kind of all ties in together. So if you think about the whole protocol of Webster's where you're working on balancing the pelvis, releasing tension from the uterus, it all works together to have the round ligaments not tighten up as often, right? Mm-hmm. If you're constantly working on keeping everything balanced out as you're going through your pregnancy, you are less likely to have those issues come up.
Yeah.
So, and then of course you don't have to, but you can ideally work on your movement patterns. So like biomechanically, how are you moving during your pregnancy so you're not adding any stress to your joints?
Sure.
Your posture, all of that.
When she was talking, I actually sat up straighter because I was like, ooh, I feel like I can feel my sacrum. I'm moving it around. Because I do that. I move around and I feel like I pop my sacrum. Is that a thing? Can you pop your own sacrum? I feel like it makes noises. Okay. Yes. Yeah. Everything in my body pops, which I'm not super jazzed about. This is kind of a random question. And if we don't want to go down the road, that's fine. I do pop my neck all the time. And I will say I've seen 2 patients in my history who, again, patient reported. So, and I don't know who they saw or where they went. It wasn't even here in Arizona. So I know it wasn't anywhere close by, but it's just an interesting story that I heard directly from a patient, 2 patients, that they had a vertebral artery tear. Mm-hmm. And they were told by someone else that it was after seeing a chiropractor. So I'm assuming that's something that can happen. And I would just love to hear. That's the only thing I tell my pregnant patients not to get done. And even if they see, because I just don't know who their chiropractor is, right? Yeah. I just say, if you want to be super safe, just don't have your neck adjusted, because I don't want it to be adjusted in the wrong way. And if you're going to see your chiropractor, make sure that they are completely certified in working with pregnant individuals. So what is any info you could share with us, I guess, on neck manipulation in general?
Ideally, you don't want to over-rotate. That's when that happens.
Sure.
So you want to try to correct the misalignment from as neutral of a position as possible. The technique that we use in the office for non-pregnant moms, so pregnant moms, I do Websters with them, but for everybody else, we use Gonstead, which is a very specific neurologically based technique. And you're moving the joint from the main direction you're moving it in is P to A, so from posterior to anterior, versus shearing it and rotating it.
Okay.
So I think the more you can limit the amount of rotation in the neck, the better it is for anybody, not just pregnant moms.
Got it. Okay. That makes me feel better.
Yeah.
I should stop cracking my neck. Sometimes do you crack your neck?
Good.
It does feel good.
When you get the cavitation, it feels good because it releases a lot of endorphins, but you're not necessarily fixing anything. Mm-hmm. What you're moving is an already mobile joint, and you can create hypermobilities, which is not ideal. So when a segment is stuck, you need that outside force to move the right bone in the right direction, as opposed to you generally manipulating all the segments that are already mobile.
Mm-hmm. Someone told me one time, because I don't know chicken or egg, but I have a very mobile neck. They were like, be very cautious when someone cracks your neck, like a person doing it. Even if a friend's like, you want me to crack your neck? Because I'm so mobile, they're like, that could be bad. I guess because it would go too far. My head would start spinning.
I would never advise to have your friends crack your neck.
Right? I've seen this though. I've seen people in at events, and then somebody's like, yeah, I can crack your neck. And I'm like, no, thank you. I don't want that to happen. But am I doing, as a general statement, am I doing harm if I crack my own neck?
Over time, like I said, the main harm that you're doing is you're creating hypermobilities. You don't want that. You want a perfect amount of stability and mobility in a joint. So if you create a hypermobility, if it's moving way too much, you're losing stability.
My head does feel like a bobblehead sometimes. I feel like it's really heavy. It's not that my brain's bigger. It's that my neck is weakening over time. Shit. All right. No more cracking up the neck. Got to be careful. Now all I want to do is crack my neck because we're talking about it, right? That's how that goes. So I think for pregnant individuals, the round ligament we kind of discussed. We discussed the pubic symphysis kind of issues. Mm-hmm. Low back pain is always the thing. I mean,
stats on low back pain.
Oh, please. Throw them at me, please.
So 75 to 84% of pregnant moms who go seek chiropractic care for low back pain have relief with their symptoms in 1.8 treatments. So let's say
basically
2 treatments.
2, yeah. That's fascinating.
I think that's really cool because a lot of moms don't do anything about it when they have all their aches and pains. They just kind of think they have to live with it.
Yeah. And you know what part of that probably is, and I don't have data in front of me on this, but I'm going to guesstimate that a lot of providers seeing pregnant individuals would say, there's nothing I can do for you. Or they would say, take Tylenol, which is, you can take small amounts of Tylenol. You don't want to take too much. It could injure your liver over time. But then if it gets worse, I feel like some providers might throw a narcotic at it, which is not the best thing to do for you or the pregnancy. And for sure over time with the concern with the opioid issues. So wouldn't it be great to try something else, non-invasive, like this? So I feel like it's hard because a lot of providers might not know that there are chiropractors that are specialize in working with pregnant individuals. And I'll say I didn't know that until I was introduced to you, honestly, which is why I'm like, I get so excited when I know any of my friends are pregnant. I'm like, hey, if you have any issues, don't suffer through it. You don't have to do this, that, and the other. There are options, The other thing too is like, I feel like when people have back pain, they want to put heat or ice on it. And the problem with heat on the low back is that the fetus is in your lower abdomen on the front side. So, I mean, you could try to work with some of those things, but you don't want to have heat close to the fetus, know? And you can't get in a hot tub. That's too hot.
Yeah.
So a lot of the things that some people might do to relax their back in general, they just aren't really able to do.
Right.
So I think that's fantastic. And for those treatments, there's nothing that's a quick pop, or it is a gentle manipulation, right?
Yeah, the sacral adjustment is usually face down, and we have drop tables.
Oh, what's a drop table?
It like pops up, and then when you give it, like when you push on it a little bit, it just drops down. So it feels better on the joint when you push. So essentially, I'm dropping the table down through the sacrum. So it feels a lot better.
Okay.
On the joint when you do that.
So if someone comes in and they're pregnant and they're laying face down, do you guys have a table with a hole in it so their belly can softly lay?
The middle piece drops down, so gives room for the belly. And then we have pregnancy pillows, so they're nice and cushiony and they have like holes in them.
I love it.
They're really comfy. A lot of my pregnant moms, when they lay face down, they're like, I wish I could just stay here and nap here, because they don't get to do that. Right?
That's what I was going to say. I bet they love it, right?
It's super comfortable, and it's not like they're there for a long time, but it's the best way to get the sacral adjustment to work on the ligaments in the backside.
Oh, I love that. I bet they do love feeling like, because you just aren't able to lay in that position at your home bed, because unless you have a bed that has a hole in the bottom of it, which that'd be kind of cool, Okay. And I know, new invention here. Exactly. If anyone out there is with a bed company and you're wanting, we have ideas. So the other thing that you do that fascinates me is you work on babies, like little babies. Tell me about the stuff you do with little babies.
So the birthing process, even if everything goes smoothly, which often it doesn't, if everything goes smoothly, it's still a lot of trauma for the baby when they're coming out. So in a normal case, usually the doctor will be grabbing the baby's head, twisting and pulling on it to bring them out. And
I will change that. Twisting and pulling sounds very aggressive for those listening. Gently guiding the fetal head out and putting traction or guided traction. But twist and pull is
depends on the doctor.
This is true. I'm sorry I interrupted. I'm so curious as to if you get any of the kiddos that may have experienced a shoulder dystocia or a mild shoulder dystocia or maybe a true birth trauma. And I think that's probably what you're leading into. So, okay, keep going. I'm so excited about this.
It could be like torticollis. It could be like some of those external stuff. But oftentimes a baby could seem fine but have stress that is in their joints.
And they can't tell you clearly because they're babies.
Exactly.
Right.
So if a baby has, let's say as an example, if a baby has a lot of stress in their C1, the highest bone in their neck, that can affect so many different things. It can affect their ability to latch properly because they have a hard time.
It's associated with breastfeeding stuff. Wow.
They have a hard time, like it's uncomfortable to turn their head one way compared to the other, so they could latch better on one side and not the other side. It could affect their ability to sleep. One big one is ear issues. So if the atlas is not sitting in the right position, if it's slightly shifted or if it's causing a lot of inflammation, it's right next to the ear tubes. So it can put more pressure on the ear tubes, not allow the ears to drain properly, and it could end up with chronic or recurring ear infections, eventually with tubes. So to me, getting baby checked and adjusted right when they come out is, again, I'm biased, but it's so important because you can avoid so many issues for them down the road if their nervous system is able to function properly and if there's no areas where there's irritation and inflammation building up. This
goes to my point of we don't know what we don't know. So like before I met you and knew about this field, I didn't know anything about it. And I have to assume that a lot of OB providers fall into the same category as me, where we don't know this exists. So in no way, shape, or form is this going to cure something like a disease process. That's not the point. It's, could we prevent some things from either occurring or worsening over time with knowing this now?
Exactly.
Right? Like, that's fascinating. The latching thing, I totally see that.
Yeah.
And babies, again, they can't talk and they can't tell you things, but maybe the fact that they only turn their head a certain direction, I guess, could give you some information. It's like you're translating, right?
Yeah, it's huge. And a lot of babies do always favor turning their head one way compared to the other, and that is a huge telltale. And another big one that I didn't mention is constipation.
Oh.
Constipation is such a good one because you adjust the sacrum and it helps instantly because all those nerves are supplying their digestive system, and it can relieve a lot of pressure in there.
Wow.
Yeah.
Okay. So then is this the same thing? Like, if they are most chiropractors that can treat pregnant individuals also then treating the neonates and babies, or not always?
Typically, I would say so.
Okay.
I would say so. If that's kind of your passion, like, I think it's so cool to be able to treat somebody who wants to have a smoother labor and delivery, because the smoother the labor and delivery, the more you're really affecting the baby's life, right? The harsher the labor goes, the more you're affecting
things that could happen.
Baby's life, right? So having to do a C-section versus going through the vaginal canal, like, that has implications, right?
Sure.
So each thing that happens that takes you away from like a smooth labor, it potentially affects the baby's health and the baby's life moving forward.
Sure.
So I love the idea of trying to take care of something before something bad happens.
Yeah.
So taking care of your body, prepping your body for labor to have the most ideal labor, and then, taking care of a baby while they're still a baby to have them be able to thrive. I think that's really cool.
Yeah, I totally agree. And I've talked with people before about this. When someone has like a labor plan, like, I love when people advocate for themselves, clearly, right? I love education and trying to ask questions and know what you'd like. And I do this all the time. If it's clear, right? Have a clarity of what your plan is and what you'd like to do. Share it with your provider so that everyone's on the same page, right?
Yeah.
And I always say, clear is kind, unclear is unkind. From Brene Brown. Have you heard of Brene Brown?
No.
Okay. I have this like crush on Brene Brown. I think she's fantastic. Her brain is fantastic. She's written amazing books. Hi, Brene Brown. One day my goal is that she'll see something I've said and that she will be like, "Hey, Lexi, nice to meet you." And I'm fangirling so bad. It's terrible. Anyway, but I love what she says with this clear is kind, unclear is unkind. And so I love the clarity that you mean of like, I want to try to have a nice labor. I'm going to try to do these things. I'm going to involve a chiropractor with my care, or a physical therapist, or both, and whomever, right? Like people that can be part of my team. What I kind of want to know too is, when someone has a labor plan, I always try to tell them, be prepared that some of this might change to be safe for you and baby.
Right.
And I think that, how do you handle that kind of when do you ever have someone that comes in and they're like, I'm going to do all this because I'm going to have a quote unquote natural labor. I will not have an epidural. I will not have a C-section. I will not be induced. I hear that a lot from patients, or I used to when I was more in the hospitals. When you hear that, how do you kind of as a provider say to them, change might have to happen?
So the end goal is that you have a healthy baby and that you're healthy, right? Like, that's kind of what we're working towards. The way to get there, you can try your best to plan and to have a vision and to, take action to lead there. But if it doesn't happen, you have to be able to go with the flow to get to your end goal, which is healthy baby, healthy mom.
Yeah, right? I love that.
Like, keep your eyes on the prize.
Yes, yes. And it comes back to clarity. Like, if the expectation and understanding is there at the beginning of your relationship with a patient, then if you get to the end of this journey of the pregnancy and not everything goes perfectly to plan, there's not a surprise of, oh, I thought everything was going to go as planned.
Right.
You didn't tell me we could have to deviate from the plan.
Right.
If you don't set that expectation or that possibility, I guess, from happening in the beginning, then I feel like we're not guiding our patients well to let them know, again, it's for healthy patient, healthy baby, and we'll get there as best we can, right? As safely as we can. I love that.
Yeah, exactly.
Okay. So I think we've covered all of our questions today. And I always try to finish up too with, is there anything else that you want to share with our listeners or anybody watching to just let us know more about chiropractic medicine in pregnancy, the opportunities that are there, anything just to share on how someone can have a positive impact on their pregnancy that kind of brings the chiropractic practice into their pregnancy?
Yeah, I would just say that, labor is a very hard thing that women do. So ideally you want to prep for it, and you want to, you don't just go into a marathon without doing
training
to train for it. So research says that pregnant women who get chiropractic care throughout their pregnancy have 24 to 39% lower labor and delivery times. So all of my not all, the majority of my pregnant moms labor for 2 to 4 hours, not more, which is really cool.
Yeah.
So to me, it's like, why not give yourself the chance to have that experience? And then also it's 82 to 92% of moms who go see a Webster's chiropractor for a breech baby will have the baby turn into proper position. So that's also really cool that you don't need to go into labor, not trying anything, going into labor with breech, because it could potentially, by opening up the pelvis and by getting everything balanced out, there's a high chance that you could have the baby go in the position that they want to go in, which is head down. So my main thing would be to have moms know that those are chiropractic care is an option out there.
There are so many reasons that babies don't come out during labor. Like some of it's cephalopelvic disproportion, like the baby and mom, the pelvis and the baby just don't really jive together. And man, if there's any way to try to do the most you can to see if your pelvis is going to be roomy enough and have the laxity, if you knew that you could try the most for it, and if it doesn't happen, you've done the most you can to give yourself a successful attempt at a vaginal delivery, which is great. And for breech presentation, there isn't a lot that studies show you can change a baby, right, and fix breech. But if you can open up the pelvis, giving the baby the best opportunity to turn on their own, that's the point, right? Like people want a magic pill. They want to say, I came in today, my baby's breech, make my baby head down. And I tell them, you can kind of do some happy baby positioning. You can move around. You can go on all fours and drop your elbows to the ground with your hip up in the air and kind of sway side to side. None of these things are magic pills, but they're trying to do kind of what Dr. Lina is talking about, trying to get some maybe mobility within the joints a little, just to get things moving,
Yeah. There's Spinning Babies, the website, so spinningbabies.com, and then there is Miles Circuit, and they have a lot of resources of different positions you can get into and moves you can do to try to, again, open up the pelvis to give baby the space so that they can get in the most ideal position for them. Because obviously, innate intelligence, we know baby, if they can get there, they want to be head down. So if they're not, it's because either there's restriction with the space, or maybe there's a cord wrapped around the head. There's a reason why they're not. But if they have the room and they're able to, it's more likely than not, they're going to go in the position that is ideal for them to come out. So
they're smart.
They're smart.
Before they're born, they're smart. I'm telling you. And most babies that are breech earlier on still will end up being head down. So the data right now says that approximately 5% of fetuses are breech at term. So even if the baby is breech around 32, 33 weeks, we now know that term, the early part of it, is 37 weeks. So you still have a higher likelihood that the baby will turn and be head down, then the baby would stay in the breech position. So, and if you have any opportunity to do things to encourage that, fantastico, you know?
Yeah.
And there's always something called an external cephalic version that you can talk to your provider about. And most OB providers still perform this or give you the opportunity. And I am in the midst of doing a YouTube on that. So it's what if my baby's breech? Kind of like, what do you do? And it'll kind of go through questions to ask your provider how to ask those questions, because they need to make sure it's safe to perform an external cephalic version and counsel you about it. And then you get to choose whether you want someone to try to manually turn your baby from butt down, which is breech, to head down, which is cephalic, by pushing on your belly. And it's not gentle pushing, let me tell you guys. An external cephalic version, if you're a provider watching or if you're a patient interested, when a doc is done trying to turn your baby manually, their hands are usually shaking because you're trying to gently and appropriately have a baby do like a forward roll. And it's a lot of pressure that's applied to try to make that happen or help that to happen.
Yeah.
But everyone should be offered that from a provider if your baby is not head down, if you're an appropriate candidate. And that's part of the counseling process. Like, let's look at an ultrasound and talk about your history and see if you're a candidate to have an external cephalic version. And if so, I'll counsel you more, and then you decide if you want it or not. And if not, maybe we do some positional things. Can you tell us those websites again? It's Spinning Babies. And I'll find the sites, but like just the names of the...
Yeah, I think my top two ones are spinningbabies.com, has a lot of resources, and then the ICPA for kids. The ICPA will tell you where to find a Webster's provider, and they have a lot of different like case studies and research and articles.
Wonderful.
About pediatric and prenatal chiropractic.
Awesome. I love it. Thank you for all this information today. Like, my mind is still spinning. Pun intended. I have heard really good things about Spinning Babies, that website, from OB providers too, that they refer their patients to it. The other thing that I will mention as a side note is moxibustion. Have you heard of that?
No.
There are some studies showing that it can help to have a baby turn. And I don't know much about it, but it is a method of putting something that's hot in between the toes, and it's almost like what's the medicine with points with acupuncture? Sorry, I'm like with points. You knew what I meant, right?
I totally did.
So moxibustion, to my understanding, is a type of acupuncture where a needle is placed between a specific area of the toes, and it's heated, I think, and then that will help the baby to possibly turn. There are some studies on this, so I'll look further into that and see if I can share any info below on that. But that's something that has been brought up, and I have had one patient in the past who found someone, because it's hard to find someone.
Mm-hmm.
It was in Florida, and they found a provider that did this and had multiple attempts, and baby never turned. But, it sounded like that provider had some good success rates in their past. And so they tried it, just didn't work. So, it's worth a try. It's worth a try. It's worth a try. Well, thank you guys for joining us today. We have expanded our knowledge, particularly surrounding chiropractic medicine and how that works or can work in the field of obstetrics. So during a pregnancy. We've also developed skills on some questions to ask and ways in which you can find a chiropractic provider in your neighborhood and places to kind of go on the web so that you can know if someone you're going to go visit is certified in certain items. And now you know the questions to ask too prior to seeing someone in that field. Finally, as always, we're hoping to have an impact on you and your pregnancy. So hopefully you were able to download some of the items we talked about and visit some of the websites here and there. If you have any other questions or comments, please leave them below in the comments section. And don't forget to subscribe to the YouTube channel for more information to continue to add to your knowledge. Thank you so much for watching today. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.